Well. Thank you so much for joining this live video. And I want you people to be so vigilant and so ready for the discussion in the that I've written there. I'm trying to set it, and I hope everything will be all right. Now, uh, as you can see, I've really stayed for a long time before going for live, and today I want just to try it for at least some few minutes so that we can discuss previous videos that I'd made about chlamydia and yeast infection, the vaginal candidiasis, uh, signs and symptoms, clinical presentation. Thank you so much, the person who has joined. I don't know whether I'm visible, whether I'm audible. I just want you to tell me something, whether everything is okay about this live stream. It's long since I joined. I did live. So welcome to Dr. PAMLI, and I want to talk about yeast infections and once more candidiasis, chlamydia. These are videos that I'd made, but I'm just doing a recap for those who did not watch them, because when you go live, it's very important to teach people when they are live. Now, in relation to the yeast infection, many people normally come to the hospital, and this is reference to ladies when they have this particular problem. Um, all those who have joined, am I audible? Because I do not have another phone that I can test whether what I'm presenting people are getting, or I'm just talking anyhow. So if at all you want to go with me live together, you can come and ask. I don't know whether it is really visible or not visible. So those who are watching me, please kindly tell me what is happening, whether it is visible or not visible. Now, yeast infection, in reference to the vagina, I said in the last videos that the pH of the vagina should be 3.8 to 4.5. That is moderately acidic. And anything that normally goes inside the vagina may interfere with this normal pH. That is why we normally advocate for no dodging. If you are a lady listening to me, know that we do not like or we do not really encourage dodging. That is washing of the vaginal area with even shampoos or those things we normally buy in shops. Basically, it is not recommended because we do not want to interfere with the lactobacillus. Lactobacillus is the microbes that is in the vaginal area, and it doesn't cause any problem. It is there relaxing. It helps to regulate the pH of the vagina. So what normally occurs, how do now candida comes? How do now ladies now start presenting with candida? Basically, what I've started with, anything that will interfere with the normal pH of the vagina. And I say the normal pH is 3.8 to 4.5. Anything that will interfere with that pH automatically will lead to the overgrowth of this candida. And the yeast that we normally talk about, it's called Candida albicans. Candida albicans. Though we have some two candidas that we are going to talk about later in this video. But for the start, we'll start with Candida albicans. And this Candida albicans is what normally causes the itchiness around the vulva of the vagina. And normally the patients present with that whitish thick discharge. That is pathognomic, that is diagnostic. Most of the patients come with, I feel itchiness around my vulva, and I'm seeing some whitish discharge which is abnormal. Sometimes they can be very smelly. Now, this candida, it's a normal flora. It can thrive even in your mouth, even in your throat, even in your anus. It is just staying there. It doesn't cause any problem. But now, how do it cause problem until you end up having candida of the mouth? That we're not going to talk about it. That is called oral candidiasis, candida of the throat, esophageal candidiasis, even anal candidiasis. Now, what happens until you reach at this level that now you will see white patches in your uh, mouth, your throat, your anus, and in relation to this video, white discharge from your vaginal area. Now, who are at risk? Number one, we normally advise our ladies not to be taking antibiotics anyhow, anywhere. They normally go to the shops, they buy antibiotics. For example, I have one that I was taking here. This is one of the antibiotics. This is penicillin. This is flucloxacillin. This is antibiotics. We have very many classes of antibiotics. We have augmentin, doxycycline, erythromycin, very many, and they have classes, and we treat people according to those classes. Now, if you are a lady and you just buy antibiotics and you use it anyhow without even doctor's prescription, those who normally take antibiotics for greater than 2 weeks, they are prone to develop this candidiasis, because the antibiotics will interfere with the lactobacillus. It will kill the normal flora in the vagina, and now this candidiasis come about. Now, that is a risk factor for getting this vaginal candidiasis. Now, when you are sexually active, I said when I was starting this video that anything that enters into your vagina, whether it is penis, it normally interfere with the normal mucosa. Sometimes there's a friction. So when there's a lot of frictions, majorly ladies who are not prepared, you know, God has created this wonderful object called vagina in a way that if you are sexually aroused, there's some fluid that comes and lubricates. So if the penis enters there, there's no friction, and this lady might not get candida. There's no risk factor. But if at all something goes there and causes friction, then you are at risk of getting this particular infection. Those who are pregnant are prone to get candidiasis. Those who are suppressed or immunocompressed, that is those who are having HIV/AIDS, those who are using a lot of steroids, those who are on cancer drugs or cancer patients, those who are having chronic diseases, or those who are in chemotherapy, they are prone to get candida. We also try to tell our ladies to avoid sugars, food rich and sugars normally interfere with the lactobacillus, and this might result into candidiasis. Even those who normally use a lot of steroids, we normally tell them to avoid this particular steroids. Now, presentation, how will the patient present? This particular patient will present, as I said earlier, the clinical signs and symptoms will be itchiness around the vulva, and sometimes it can swell, and sometimes it can have sores. When this particular person will be going for a short call or even urinating, there will be burning sensation during passing of urine. You feel your urine is burning you, and this is a warning sign. Soreness and redness, I've said, and even rash. Now, what is pathognomic is the whitish discharge, and that is thick and clumsy, and it looks like cheese-like in appearance. So those are the clinical signs of how the patient will present, those who are having candidiasis. Now, how will we diagnose this? Of course, we will do what we call physical examination and even the history. How you come to the hospital, you will simply tell us your signs and symptoms. Together with the physical examination that we will do, we'll be able to take vaginal swab and when your urine to the lab, we'll do what we call urinalysis and look for any past cells, any evidence of candida in your urine. And we may also do culture and sensitivity. This is now, we take your urine, we grow it in a media, and after some few days, it will tell us the specific drug and the specific type of candida we are dealing with. I said that we have 3 candidas that we are going to talk about. I said that the now one that we are now talking about is Candida albicans, but there are 2 that we are going to talk about also. Now, ladies, how can we present this? How can we prevent this? Wear breathless underwear. Cotton is the best, and loose clothes are the best to wear. Do not dodge, as I've said earlier. This is now those who normally use even lubricants, those who are normally washing their vagina using different types of